Hello, my name is Natalie Plump, and for this informative research presentation, the topic will be battling the risk of wrong site surgery. Although the likelihood of being a recipient of wrong site surgery is minute, entire medical units must collaborate and perform efficiently to eliminate error during every surgical procedure. Types of wrong site surgery are categorized into wrong patient and wrong site. An esteemed group of highly knowledgeable doctors initiated a meticulous study called the Analysis of a Prospective Database of Physician Self-Reported Occurrences. The intended purpose of this study was to determine the frequency, root cause, and outcome of wrong site and wrong patient procedures. After screening through more than 27,000 adverse occurrences that were reported to the Colorado Physician Insurance Company, these cases were carefully limited to only 132 operations, of which included 107 procedures performed on the wrong side and 25 procedures that were on the wrong patient. It was discovered that a substantial amount of oversight was in direct correlation with the error in diagnosis, miscommunication, and miscued judgment. Physiological consequences are classified into death, significant harm, and no harm. Unmistakably, the most tragic of these consequences would be death. This applies exclusively to the patients who unfortunately passed away as a direct repercussion of the erroneous surgery. Although not as extreme as death, significant harm was applied to those occasions in which a procedure was operated in either the incorrect patient or at the wrong site, therefore causing permanent structural and functional impairment. A no-harm event was designated to the specific incident of an invasive operation that was never fully begun. Occurrences such as regional or local anesthesia injected at the wrong site or preparation of the wrong patient. Although some of these patients can be fortuitous enough to escape the permanent effects of a doctor's malpractice, others' lives are never the same. When undergoing surgery, the patient is literally placing their life into the hands of the medical team, dependent on their knowledge and judgment. Laying there on the operating table, the client is completely helpless to their surroundings. For most, this stirs up a plethora of anxieties and fears that something will go awry. By chance that this patient is a victim of wrong site surgery, it could forever alter the way they view the healthcare system, causing the client's trust in doctors as well as medical personnel to never be the same. Evidence-based practice is the integration of clinical expertise, patient values, and the best research evidence into the decision-making process for patient care. Two ways evidence-based practice can be implemented into procedures would be the surgical safety checklist and the universal protocol. The surgical safety checklist involved key elements including having the patient confirm the surgical site as the surgeon marks the site. In addition to this, double-checking the x-rays against the marked site to be operated on, confirming that the informed consent had been appropriately signed and understood, and verifying the correct site by the surgeon and other members of the medical team are all essential steps to be taken before the procedure. The Joint Commission had devised the Universal Protocol and attempted to combat wrong site surgery and included implementing the preoperative verification process of all relevant documents before the start of the procedure and conducting a final verification or timeout immediately before starting the procedure. The timeout involved the entire surgical team to confirm the presence of the correct patient and procedure to be performed on the correct site of the operation with reference to source data. Although there will always be a risk that accompanies any surgery, through implementing evidence-based practice, using clear communication and effective confirmations, the possibility of malpractice is tremendously diminished. Even though healthcare organizations have come a very long way, they have not quite reached their destination. Healthcare in its entirety should be continuing to strive towards a better outcome for their patients and pursuing prevention, always battling the risk for wrong site surgery.